Assalamu alaikum, doctors. How are you all?
Wa alaikum salam.
Hoping you enjoy your journey of cases, inshallah. It's a very pleasurable journey. Try to enjoy it, doctors. Okay, so open discussion for 2 minutes. Anyone has any question to ask me, I will be glad to answer him or her. Any questions? Don't worry, doctors. Anyone has any question, he can ask or she can ask.
Dr. Osama, my problem in station 5 is how to analyze the complaint to reach rapidly to the diagnosis.
A brilliant question. Okay, so we will have examples, Dr. Muhi, about that. That's why I am glad to work in station 5 in these 3 sessions, because it's very important to get full mark in station 5 to pass your exam. It is mostly if you didn't pass more than 20 on every case of station 5, you will not pass the exam, because the concern, if you didn't get the diagnosis early, or even didn't get the diagnosis at all, you may lose your whole exam because of that. So that's why station 5 is very, very important. So some cases now are for differential, actually, regarding station 5. So we will cover most of the important cases, and you have to work on that with your study partner, okay, to be throughout, to be confident, to be organized, to not miss anything important, to ask about concern at this price. Like I told you in the last session, you have to be fast in station 5, because in UK, surrogates are talking a lot. So that's why it is very, very important to be organized, to be without jargons, without repeating questions, okay, to start examination early, ask about concern early. Okay, so we will have an example today, Dr. Muhi. If you want to take the case, I have no problem at all. What do you think?
Okay, no problem.
Okay. So we will start today, inshallah, by station 5. Dr. Muhi will be our candidate today, station 5. This is 42. Female patient, Miss Sandra, complain of skin rash. For your kind care and assessment. So you have 1 minute to prepare yourself, Dr. Muhi. So, Dr. Mahi,
Yes, sir. Yes.
yes, you can start there.
Good morning.
Good morning, doctor.
I'm Dr. Mohi, SC3 doctor here in the medical ward today. Am I talking to Miss Sandra?
Yes, doctor.
42 years old. Nice to meet you.
Likewise, doctor.
It comes to my knowledge that you are complaining from skin rash. May I will take some questions from you and examine you?
Yes, doctor.
Can you tell me the onset of this skin rash?
Well,
When?
it all started about 2 months back, doctor. It started gradually and increasing in size.
Is there anything else you are complaining from other illnesses than skin rash?
No, doctor.
Only
Show
skin
me the
rash?
rash, please. Yeah, tell the patient,
Yes,
show me the rash, please.
Yes.
Yeah.
Show me the rash.
So here it is, doctor. So it is in the right and left flexural side of the patient.
Okay. This looks like implantus.
So, doctor, it's itchy. Is it itchy? Yes, it's itchy, doctor.
May I ask you, you have any other complaint?
Well, doctor, it started all of these about 2 months back. I have no other complaint other than it is very itchy. It really disturbing me, doctor. It's turning my life to a terrible state.
Any previous attack like that before?
No, doctor.
You have any, what about your health in the past?
Yes, doctor. Well, I have high blood pressure and I'm taking medication for it.
What medication you receive?
I'm taking bisoprolol 5 milligram and hydrochlorothiazide tablets every day.
Is there any change in the dose recently for such drugs?
No, doctor.
There is no rise in the blood sugar?
No.
Any other drug other than this bisoprolol and thiazide?
No, doctor.
May I ask you a private question?
Yes, doctor. Of course.
Do you smoke?
No.
Do you drink alcohol?
Yes, doctor.
How much?
About 7 minutes per week, including the weekends.
What is your job?
I'm an accountant, doctor. I'm a secretary accountant at a company.
This itch skin rash affect your job?
Yes, doctor. It's affecting my life, as I told you before.
I'm sorry for that. We hope to help you today for such skin rash.
Thank you, doctor.
May I ask you another private question?
Yes.
Are you married?
Yes, doctor.
What about your period?
I'm sorry to ask you this private question. So it is normal, doctor.
Okay. Is there any pregnancy before?
No, doctor.
Any miscarriage before?
No, doctor.
You are using oral contraceptive pills?
No, doctor.
Is there any disease running in your family?
Well, doctor, my mother has diabetes mellitus and my father died of heart attack.
This heart attack, I'm sorry for that. This heart attack, how old he was at that time?
55.
I'm sorry for that.
Thank you.
May I examine you, Miss Sandra?
Yes, doctor.
I will examine. Sorry, I wanted to ask you: is there any other rash, or there is any rash come?
Well, yes, it is on my legs, doctor. And other than this, I don't know.
So I will see if is there any other rash in the body,
Okay.
in the scalp, in the malar area, and I will see also if there is any rash in the lower limb, as you told me.
Okay.
And then I will proceed to check the pulse, blood pressure, heart auscultation, chest. I will palpate the abdomen for any organomegaly. May I ask you, is there any mouth sore?
Well, doctor, yes, I have soreness in my mouth.
Since how long is this?
For about 3 months now.
There is any change in your bowel habit?
No.
Any joint pain?
No.
Any rise of temperature?
No.
Okay. Can you tell me, Ms. Sandra, what is your concern?
What's happening to me, doctor?
From my examination, you and taking history of you, this rash named as mostly lichen planus rash. I will do for you some blood test, and may also I need imaging test. Then I will include multidisciplinary team for your management, including the dermatology or skin doctor for this. Any other concern?
So is it curable, doc?
Yes, it is curable.
Okay, doctor. Thank you. Time finished. So what is your differential diagnosis, doctor?
First priority for me, this looks like.
Okay, so what about the treatment for lichen planus?
I will start for here local corticosteroid.
You will start yourself? Are you the specialist?
I'm not a specialist in dermatology, but I will refer here to skin doctor or dermatology doctor for.
Okay, you said to the patient it is curable. Do you think it is curable?
Yes, it is simple.
It is simple and curable. Okay, so what about beta blockers and thiazide? Do you think it is related to this skin lesion or not?
Really, I don't know, but I will tell the examiner that may.
How could you? I am the examiner now. So how could you diagnose this patient? Be sure of the diagnosis.
It is a good diagnosis, but maybe biopsy is diagnostic for such case.
ايه العظمه والثقه دي؟ انت خطير والله العظيم، انت يا دكتور محي هتبقى خطير جدا في الامتحان. ايه يا عم، ايه العظمه دي؟ ايه العظمه اللي انت، ايه الثقه دي؟ I will give you 0 of 28 with all pleasure because it is not allowed in PhD exam to give false information. If you don't know enough, if you don't know, think till I don't know. This is the most important to pass the exam. Don't ever dare to say something wrong. You will guarantee a lose in all the exam. You will lose all of your exam if you do it like this.
So how I will answer this question to the examiner?
If you don't know enough, if you do not know, say I don't know. Okay, so let's take it piece by piece. First of all, your diagnosis is correct, but I guarantee you a 0 in this case if you did like this. I'm not judging you, Dr. Muhi. Don't take it personal, but I'm teaching you how to make it perfect. Okay?
Yes.
Overall, you are brilliant. You are very brilliant. No worry. You have just to follow the rules to pass the exam. So, you did a fatal mistakes, of course, but something very good Okay, the something that is very good that you started examination early. Okay, this is very brilliant. And you asked the patient about the rash. Is it the first time any other rash in your body? You asked about mucous membrane. You checked for the hair, any affection of the hair. This is brilliant. But from the start, you didn't ask any any rash, Dr. Mohi, you see in front of you in the exam. Ask about, is it painful? Is it itchy? Is it oozing? Is it bleeding? Okay. So for doctors who are asking about the scenario, this was Miss Sandra, 42, female patient, complaint of skin rash. So don't be very happy, Dr. Mohi, if you found a skin rash that you know, because you have to concentrate so much to not lose your case. Here, with all pleasure, you lost your case for a lot of reasons. But make it piece by piece. Number one, you asked about broad lines. Very good. You asked about family history, medication list, past medical history. You asked about social history, but not full social history. You didn't ask about illicit medication. You didn't ask about financial problem. You didn't ask about driving. You didn't ask with whom you are living. Okay. You asked about impact, but you didn't offer help. This is a very fatal mistake, very brilliant fatal mistake. Why we ask about impact? To offer help. Make it a rule in your mind. We ask about impact on the patient job and daily activities to offer help. So any patient complain of any pain, offer pain relief. Any patient complain of any rash, offer treatment for the rash to alleviate the itching. Sorry, treatment for the itching. Okay. So the patient told you, it turned my life to a miserable state, and you just neglected it. This is the hidden concern. If you did like this, you will lose your exam. Because concern in session 5 equals 8 marks of the 16 mark of the exam, of the whole exam. So if you've lost 4 marks here and 4 marks here in session 5, you lost your, regardless of your performance in other stations. So number one, appreciate the concern. As I told you before, any concern, appreciate it. And answer the concern by we, not I. Okay? Try to avoid jargons. You didn't ask any of the autoimmune association of lichen planus. Lichen planus is autoimmune disease or autoimmune condition. So it is very important that you ask about all of the autoimmune. You ask about everything. You exclude Addison, you exclude pernicious anemia, celiac, diabetes mellitus, thyroid. Okay, you should examine the thyroid. Okay, very important. So regarding the antihypertensive medication here, there is something called lichenoid drug reaction or eruption. It is very important to consider this as an exacerbate or something precipitated this skin lesion. And you should ask the patient when you started to take it. Your medication list history is very deficient. You have to train yourself to be rapid and organized in the medication list analysis. Show me your medication list, please. So after that, we'll ask the patient. So everybody mute himself, please, doctors. So you'll ask after that, any new medication, where is the over-the-counter medication? Okay. After that, ask about any herbal medication. Everyone mute, doctor, please. So regarding past medical history here is very tricky, and concentrate with me, doctor, please. So when you ask about any chronic diseases that you are treated for, the patient will tell you. If he has any long-standing disease that he has treatment now for it, he will tell you. But here, hepatitis C virus infection, if the patient treated for it, he will not tell you about it. So you should ask any past medical history of note. This is very important. This is a take-home message, one of the take-home message from this case. Any past medical history of note. So the patient will surely now tell about hepatitis C virus that he got treated for. So lichen planus could be drug-related, could be hepatitis C virus related, could be idiopathic. Could be just idiopathic. And if you excluded a drug cause and the hepatitis C virus in the past treated, you should ask about all of the autoimmune that I told you now. And you should search for the skin. the hair, the nail, the mucous membrane, and ask the patient about any problem with intimate relationship, especially the female patient here, because it could affect the vulva. Okay, so ask about genitalia and examine the mucous membrane for Wickman line or Wickman striae. It will be something like whitish eruption with ulceration on the center. So the most fatal thing you did here, that you answered with wrong answer. Don't ever dare to give the wrong information to the patient in any station. It is not accepted. Okay, you may lose the whole exam because of that. So when any examiner or any surrogate asks you about something you are not sure, tell the examiner or the surrogate, at this point of time, I don't know, or I will check and tell you in our next appointment. So here the patient asked you, is it curable? Actually, lichen planus is not curable like any autoimmune disease. Nothing of the autoimmune disease are curable. It is treatable or controllable. I highly appreciate your concern. I'm very sorry to tell you that this condition is not curable, but it is completely controllable or treatable, and you can live near normal life. We have treatment to alleviate the itching. I will help you regarding this. I'm very sorry that it's disturbing your life. And ask about sleep. Does it affect the patient's sleep or not? So generally, lichen planus diagnosis skin biopsy, but it's a clinical diagnosis, exactly like psoriasis. We may give the patient, so we refer the patient here to a skin doctor, and a skin doctor to treat him, and a heart doctor to may need to switch the drugs you take for your high blood pressure. So generally, if the examiner asks you, it is a self-limited disease or a self-limited. I don't like the word disease. Try to use condition, self-limited condition within 6 months to 1 year. But we may use topical steroid or systemic steroid or oral retinoid, and it is not my specialty. I will refer the patient to skin doctor. You asked about female history. This is very important. You should ask about travel history and trauma history in any patient. And you should ask about some general question in any case. Like here, you should ask about weight, about appetite. You ask about fever, good. You ask about joint pain, very good. You should ask about fatigue, weather preference, any other skin rash, any skin color changes. Okay. You should ask also about any water work changes. You asked about bowel habit. I don't like the word bowel habit. Bowel, some examiner will consider bowel a jargon. So use back passage, very, very professional. No jargons in it. That's all in this case. So the differential diagnosis for this case could be porphyria cutanea tarda, but porphyria cutanea tarda will be on the dorsum of the hands and exacerbated by sun exposure. Okay, it could be cryoglobulinemia, but against the patient has no other vascularity in his body, and cryo will be mildly itchy. Leiomyomatosis is the only severely itchy lesion in PACES exam. So brilliant that you know it from the start, but don't be very happy, as I told you, because you lost your case because of the causes that I told you. Clear, Dr. Mahi? Hello?
Yes, sir. Yes.
So, Dr. Mahi, very, very nice start, but try to be very cautious with wrong information, not allowed in PACES exam. Okay?
Yeah, sorry, والله, I wanted to know. Yeah, it's because I think yes, it is treatable, or this is self-limited condition, or
like I told you, it is not curable, but it is treatable or controllable. You can use some medication to alleviate the itching, hoping it will get better. Okay?
I told the examiner also I can diagnose this rash by inspection only or spot diagnosis, but may we need biopsy? This is wrong, huh? This is wrong to say that for the examiner.
Well, you will tell the examiner it could be a clinical diagnosis, but the definitive diagnosis, to give a definitive diagnosis, a skin biopsy, exactly like psoriasis. Okay? Okay, thank you, Dr. Mahi. Thank you, dear. Very nice, very well, nice start. No worry. You are brilliant, but just follow my advice to pass this exam. Okay, thank you. Okay,
Thank you.
thank you so much. Okay, so for doctors who is asking, who was the question? Yeah, I like it. It is a pack passage. Any pack passage pregnancy, any hard motions, any loose motions. This is the correct question. Okay, we will move on to the next case, station 4 case. Who want to take the case? Differential diagnosis, doctor, you could say psoriasis, you could say porphyria cutanea tarda, you could say cryoglobulinemia, anything, no problem. But here, the medication for hypertension must be switched, and this is a heart doctor referral. That's why we will refer the patient to the heart doctor. Okay, who want to take station 5, station 4 doctors? No.
Hello?
Yes.
Dr. Lalit here.
Who with me, Dr. Who?
It's Dr. Lalit.
Dr. Lalit.
Yes.
Okay, so when will be your exam?
I have applied only yesterday for the 2020 first
This is your first attempt?
Yes, this is my first attempt.
Brilliant. Okay, so
yeah.
We will take a session for Dr. Lalit, right?
Yes, Dr. Lalit,
okay.
Yes.
Okay, dear. So this is Mr. Peter.
Okay.
67 male patient. Was admitted 2 days ago to the hospital with pneumonia.
Okay.
With her score of 5.
Okay.
So at the time of admission, there were no bed available in the ICU nor the internal ward. So the patient was admitted in the surgical ward.
Okay.
Unfortunately, the last night his condition was deteriorated and he was transferred to ICU. While on the way to ICU, his line was dislodged and 1 dose of antibiotic was lost.
Okay.
So when the patient arrived to ICU, he had medical team tried to resuscitate him, but it was unsuccessful and the patient passed away. So you are the senior health officer. You are the senior health officer of the medical department. And call today, you have been asked to discuss this issue with Mr. Alfred, his son, about what happened to his father and address all. You have 2 minutes to prepare yourself, organize your thoughts, make a scheme for the case, Dr. Lalit, and then we will start.
Yeah.
If you want anything to be explained, tell me, dear, and I will explain before we start. So, Dr. Lalit, please try to minimize the echo that is beside you, please, because I don't hear you too well.
Okay, can you hear me, sir, now?
Yes. Okay, you have 2 minutes to prepare yourself, Dr. Lalit.
Sorry, can I ask one thing?
Yes.
Sir, did you say that the antibiotic dose was also missed?
Yeah.
Okay, sir. Thank you.
Yeah, thank you, dear. So they are repeating the scenarios now. This is the trend. That's why we are discussing the case that is frequently appearing. Very important case. Dr. Lalit. Hello? Dr. Lalit. Doctor, anyone could hear me, doctors?
Yes, sir.
Okay, thank you, doctor. Dr. Lalit?
Yes, we can hear you.
Thank you, doctor. Dr. Lalit, hello? Okay, we will wait him for 1 minute. So anyone want to prepare the case in case of is not coming? So we will start with another colleague. Dr. Puneet.
Do it, sir? Yes, sir. Can I do it?
Prepare yourself in case of, we will only wait 1 minute to not lose your time, doctor. So 1 minute only. If he not here, we will start with you, Dr. Puneet. So prepare yourself, dear.
Mr. Alfred is the son of Mr. Peter.
Yeah, Mr. Alfred, son of Mr. Peter. You read the scenario well? Because I didn't write all of the scenario. This is not all the scenario. You want me to explain it more or you hear that?
Sir, if you can tell me, please. I was not...
Okay. So this is Mr. Peter, 67, male patient, was admitted to the hospital 2 days ago with pneumonia, okay, with a curb score of 5. At the time of admission, there was no bed available in the ICU nor the internal medical department, so the patient was admitted in the surgical ward.
Okay, sir.
Yesterday's night, the last was sedated and the patient was transferred to the ICU. While on the way to the ICU, his line was dislodged and missed dose antibiotic. When transferred to ICU at the time of transferal, so the patient had a cardiac arrest. And trials of resuscitation was done for him, but it was unsuccessful, and the patient passed away. You are the senior house officer of the medical department. You have been asked to discuss this issue with Mr. Alfred, son of Mr. Peter, about what happened to his father and address his concerns. Clear, Dr. Puneet?
Okay, sir.
Okay. So you have 1 minute to prepare yourself, Dr. Puneet, and then we will start.
Yes, sir.
Okay. Dr. Puneet.
Yes, sir.
So you can start, Dr. Puneet.
Okay, sir. Hi, Mr. Alfred.
Hello, doctor.
I am Dr. Puneet, one of the senior house officers in the ward. Are you the next of kin for Mr. Peter?
Yes, doctor.
Mr. Alfred, we are here to discuss your father's condition. Do you want anyone else to be a part of this meeting?
No, I'm fine, doctor.
Okay. So, Mr. Alfred, are you aware of your father's condition?
Yes, doctor.
Can you tell me what all you know about him?
Well, doctor, my father was admitted here 2 days ago. He was doing very poorly, doctor. He was having this bug infection in his chest. This was the first time he had this one. So I bring him, doctor, to the hospital, and I think you did your best, doctor. So I had a phone call from you while I was at work. So I'm very concerned. So what's about my father? Is he okay, doctor?
Unfortunately, Mr. Alfred, I do not have a good news for you.
What do you mean, doctor?
Unfortunately, Mr. Alfred, despite our best efforts, we could not save your father.
Oh my God. What do you mean, doctor? I didn't get you. Is my father okay?
Unfortunately, Mr. Alfred, your father has passed away.
Okay, the surrogate is crying, Dr. Punir.
Mr. Alfred, please take this tissue paper, and I'm sorry I have to give this bad news to you. We all are with you in this bad time, in this difficult situation. But we tried our best to save your father, but unfortunately, we could not.
The surrogate is still crying.
Mr. Alfred, do you need a glass of water?
Yes, doctor, thank you. So tell him you want to continue this meeting or postpone it, and then proceed, Dr. Puneet. You can proceed. So, doctor, what happened to my father? Why he died?
Mr. Alfred, your father was admitted with a very severe chest infection, and we started him on antibiotics. Unfortunately, there were no beds available in the medical ICU, so we had to shift him to surgical ward, where we continued the antibiotics. But unfortunately, yesterday, one of the IV line got dislodged, and but despite that, we continued our best.
Doctors, you killed my father. Oh my God, who is responsible for this? I want the name of the doctor who is responsible for my father.
Mr. Alfred, it's a team effort, and no single person is responsible.
I highly appreciate your anger.
I do understand you are angry, Mr. Alfred, and you have in such a difficult situation. I can understand your agony and your reactions. But your father was admitted with a very severe chest infection, where the chances of survival despite IV antibiotics are very poor. And we tried our best. Our whole of the team of doctors tried our best to salvage him, but unfortunately, he could not make it.
If you didn't have a bed in the ICU, why, and you are now telling me that my father's condition was very advanced, why you didn't admit him in the ICU from the beginning? And if you didn't have a bed, why you didn't refer him to another hospital? Such a negligent doctors.
I'm sorry, Mr. Alfred. We didn't have those beds in the ICU. It happens sometimes. Ours is a very busy hospital. But in case of in such a patient who is very sick and has such a severe chest infection,
you are treating my father like this because you are treating him like this because of an old man.
Mr. Alfred, I'm sorry you are feeling that way, but we don't distinguish any patient by caste, creed, sex, skin, or race or age. We tried our best. Your father was immediately started on antibiotics as soon as he came to the hospital. We didn't have beds in ICU. We shifted him to the surgical ward, but the medical team, which looks into the ICU, was looking after him.
Why you didn't refer him to another hospital?
Mr. Alfred, because your father was very sick, and shifting him to another hospital could have lost some precious time in which we could take care of him. We started and
father, you already killed my father. You didn't give him the dose of antibiotic that he needs. That's why he died.
Mr. Alfred, I'm sorry you're feeling that way, but your father was admitted with a very severe chest infection. In such a condition, despite antibiotics, the chances of dying are very high. I do apologize on behalf on my team because the cannula got dislodged, but that was not the cause for his death. Missing only one single dose of antibiotic would have very unlikely changed the outcome. But because of this incident, we are going to raise an incident report and inform the senior staff nurse, and I am going to inform my consultant so that these things do not happen in future.
I want to make a complaint.
Yes, Mr. Alfred, making a complaint is your right. I am by your side and I would help you out in that. We have a patient advisory licensing system. I can tell you the contact details of the same, and you can definitely make a complaint. It's your right.
Peter.
I'm sorry, Mr. Alfred, I have to give you this bad news, but despite our all best efforts, we just could not help your father. May I ask you some questions about your father?
Okay, doctor.
How was he doing apart from this chest infection?
Irrelevant.
Okay.
I want to meet your consultant.
Yes, Mr. Alfred, I can arrange a meeting with my consultant very soon. No issue in that. I apologize on the behalf of all of my team that we could not save your father, but we tried our best. Our team is one of the best teams in the hospital who takes very good care of the patients, but your father was admitted with a very poor chest condition.
How do you feel now, Mr. Alfred?
How are you feeling now?
Okay. Are you following me? This is called rapport. Okay.
Mr. Alfred, do you want anything else from me? Can I help you in any other way?
No, doctor. Thank you. So give me the certificate, doctor, now, please.
Okay, Mr. Alfred, we'll try to give you the death certificate as soon. And do you want me to disclose this information to any other of your family member?
No, doctor, I'm fine. Thank you.
Sorry again, Mr. Alfred. We will try to give you the death certificate as soon as possible. And I would like to let you know the follow-up of the incident report, which we are going to raise as well. And may I know how you feeling now?
I will be fine, doctor. Thank you.
Okay, Mr. Alfred. Thank you.
Thank you. Okay, I'm the examiner now. So, doctor, what are the legal issues here?
Well, the issue are autonomy. The patient son has the right to know about his
legal issues, not ethical. Legal
issues are complaint, and
okay.
Legal issues are capacity, and
capacity of what? The patient already died.
Legal issues are death certificate. And
okay, so number 1, complaint. Number 2, the certificate. Number 3, what? You have to be fluent with the examiner, Dr. Puneet. You have to write it down while you are talking to the patient to answer the examiner. Okay, report, the third one. So, Dr. Puneet, did you make a drawing for the patient?
No, sir.
Okay, so overall, Dr. Puneet, I will give you 12 out of 16. Why not 16 over 16 despite your great performance? Your performance, I would say great, because you covered all the legal issue. This shows that you are a competent doctor, you are a professional doctor, Dr. Puneet, proud of you, but you didn't, number one, do a drawing for the patient. This is your pitfalls in this case. Number two, you didn't offer help to the surrogate. How? How in this case you offer help? Number one, you have just to ask 2 questions in social history in this case. With whom your father was living? Anyone drive you home? And after asking if anyone was living with him, does he or she or they need any help of any kind we can support? Number 3, no summarizing here. I agree completely with you. Brilliant for not summarizing. And no check understanding, of course. Okay, you just offer help by offer the patient to drive him home. So what is the third pitfall you did? Sympathy, empathy, and rapport. I see it is deficient. How? You apologize for the patient once. This is not enough. Despite the missing 1 dose of antibiotic is not, of course, is not responsible for the patient death, but it is not allowed to just apologize once. Okay. No, apologize at least 5 times in this case, and be very sorry for what happened to his father, and my condolences for your loss on behalf of our team. Okay? Okay. So there is 2 ways here to break the bad news. You did one of them and it is perfect. I have no comment except of the drawing after seeing what happened to him. So number 1, you will explain to the patient that his father passed away and golden silence. You can do that, of course. But this is the hard way. I would say it. This is the hard way. The easiest way, the news is not as we hope. Golden silence. What you mean, doctor? May I explain to you more? Okay, you will explain that your father came to us 2 days ago complaining of blah, 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 blah. You explain the rule until the cardiac arrest tried to resuscitate his heart again, but unfortunately it was unsuccessful. We did our best, Mr. Alfred. I'm very sorry to tell you that your father had passed away. This is brilliant. But while you are explaining to the patient, for doctor who is asking me now about how to draw in this case, you will draw a chest, 2 lungs. And what do you mean by chest infection? It is a bug infection there. This is only the drawing. This is how to get full mark in clinical communication, as silly, as easy as that. Very important to draw. It is a crucial thing in the clinical communication skill, in the clinical communication station in PACES exam, to draw anything. So you will, here your task, you explain to the patient that his father's death was related to his advanced condition. This is very important. And if the examiner asked you, what is the death rate of the curve 5 score, you will tell the examiner from 20 to 40. 20 to 40. Okay? The mortality rate. Yes. You will express to the patient that what happened regarding the missing 1 dose is not acceptable and shouldn't have happened at all. And we'll take it seriously, and it was unintentional. And here is the issue of that my father is an old man, and you are treating him like this. You will answer by the justice. You will tell him, I highly appreciate your feeling. I can only imagine. This is the way of showing empathy, that you are putting yourself in the patient's side. I can only imagine how this difficult situation for you. Dr. Puneet, I will mute you, dear. If you want to ask anything, just ask, dear, okay? Because there is an echo. Okay, so I can only imagine how this is difficult for you and your worries and how angry you are. And don't ever interrupt the patient. He can interrupt you at any point of time, but don't ever do it, except if you want to lose your exam. So you will write an incident report. You will raise this issue to your consultant. high morbidity and mortality meeting, root cause analysis, all of the scheme of the medical error must be done here. Yes, it is a medical error, but yes, it is not responsible for the patient death, but it is medical error. Don't underestimate that, or the patient will be very annoying to you in the exam and you will lose the station and the examiner will be not satisfied. So try to make it as a serious event that happened, but try to be very clear that this is not the cause of the death. This is very important, and you can do it, and you already did it, but you have to show some more empathy and sympathy and pauses. Natural pauses in PACES exam in these, like this situation, is very professional. Do not be afraid of pauses. Just pause and look at the, maintain eye contact. How do you feel now? That make any sense for you, Mr. Peter? You have to be an actor in such scenarios, and you will guarantee a 16 of 16 if you did like this. So don't tell the patient I know. Don't tell the patient I can understand. No, tell the patient I highly appreciate what you are going through right now, Mr. Peter. I'm very sorry for what happened to your father. So very sorry doesn't equal a medical error. Very sorry equals sympathy. Very sorry. But you have to apologize here of the medical error that happened, okay? And you will tell the patient, yes, you did our best, okay, to save his life, okay? And regarding the issue of refer my father to another hospital, you will tell him after appreciation and after every sympathy and empathy, you will tell him that unfortunately there was no bed available at the time of admission of your father, and referring him in such situation would be very risky to his health at this point of time. So what we did is in the best interest of his condition to admit him in the surgical ward and giving him the best care and management. Okay, I want to complain, perfect answer. Any patient want to complain of her health, I want to meet your consultant, this is definitely his right after appreciation, and you will arrange a meeting. So doctor, as that's what I said right now, dear, why not shift to another hospital? That's what I answered now. That is, this was done in the best interest of the patient, and transferring him at the site would be very risky. So transferring him at the point of admission would be very risky. Why no postmortem here? Because a lot of my candidates did this case with me and explained a postmortem here, and this is a pitfall, a very big pitfall. So why not postmortem? Postmortem coroner or postmortem hospital. So postmortem hospital means that it is something optional, and it would be ordered from you in the task clearly. Okay, so no hidden agenda in postmortem hospital. In postmortem coroner, why this case is not? Because number one, the patient was expectant to die, high mortality rate up to 40. So this is number one cause. Number two, because there was more than 24 hours of admission. The patient was admitted 2 days back. So if more than 24 hours, no postmortem. Okay? Okay. There are other indications for the postmortem coroner. This is not will be discussed in this topic. But here, no postmortem coroner because of these two causes. Number one, the patient was admitted more than 24 hours. Number two, the patient was expecting to die. Expected to die. Postmortem coroner, no, it another indications. That's all regarding this case. Very easy case, very common case. Okay, so best of luck, Dr. Puneet. You really did it great, dear. It is just about rapport and empathy and sympathy and apologizing more and offering help. As I told you, in such cases, you did it. You did this case brilliantly, Dr. Puneet. Thank you so much and very well done. Best of luck in your exam, dear. Inshallah, you will pass it. You can pass it, dear. Just make confident in the exam, and it's your day, and you can pass it. Reassure me after your exam, dear. Thank you.
Here, doctor, he don't know that his father died already, and is missing dose of antibiotic and the cannula dislodged, and this is not. It no. If I despite I am honest with the patient, with the surrogate, and I tell him everything, but this is. I will open to me more questions, not already useful for the discussion.
This is your job. Yes, of course, you will open the because you have to be honest with the patient of what happened, and because it is an error. If you didn't speak about it, you will lose your station. This is something wrote down in your task, in your rule. You have to speak about it.
Hello, Dr. Osama. Yeah. Can we also make some notes while we do the communication? This is Dr. Lalit here. Sorry, there was some connectivity issue, so I couldn't actually come on time. So what is your question? Can we, as you said, that can we make some notes while we do as well? Is it okay?
Yeah, yes, of course. Of course. You will have a white paper and a pen, and you can write down notes, of course.
And the scenario that they gave us at the start of the exam, can we carry it with us inside as well, right? During the exam?
No. The scenario will be left out.
No.
Yes.
Okay.
Yeah, and the white paper will be left with the examiner, actually. You will not get out with it.
Okay. All right. Yeah. Okay, dear.
Thank you, Dr. Lalit.
Thank you so much, Doctor.
Thank you, dear.
No problem.
Sir, I have a question.
Yeah. Yes, doctor.
Sir, in this case, when the attendant was asking for a death certificate, so should we just refer? Yes, sir.
As soon as possible, like Dr. Puneet did. Yeah.
Okay, and don't we mention about the colonel after discussing, after referring?
You will not.
Okay, sir.
Yeah, no suspicion in this here. Postmortem coroner will be discussed. I promise you, postmortem coroner will be discussed in the next 3 sessions to make it clear for everybody. Inshallah.
Okay, sir. Okay.
Yeah.
Okay, all right.
So as I told you, no postmortem coroner here for 2 reasons. The patient was admitted more than 24 hours. This is number 1. Number 2, right. The patient was expecting to die. Yeah, right. Postmortem coroner, if the patient was mentioned in your task that the patient was improving. And we will discuss a case resembling to this one. Okay?
Okay.
No problem at all. Okay. Thank you. Thank you, doctor. Okay, doctors, to not make it long for you, thank you so much for attending my session. It's my pleasure. Hope every one of you get benefit of it. So I will announce on the next 3 sessions, inshallah. Meet you soon. Thank you, doctors. Assalamu alaikum.
Thank you. Thank you so much, doctor.
Thank you, dear.
Thank you.
Assalamu alaikum. Thank you, doctor.